Hey, Alyssa again. Okay, so here's our treatment. You have a soft tool for grandpa and grandma. Um, if you don't have that tool yet, you can easily roll up a towel. And you can have that behind your head in the same position that we're going to use this roller. If you have a hard roller, please put something soft around it. These are muscles that if you're having a headache, there's compression on them. Do something nice and kind for the body. It is so much better for the body not to have to protect you anymore. So let it sink down in. So if you have something already hard, put something soft around it. And I really encourage uh, to have that soft. So at night, before you go to sleep, I'm hoping this can be a daily routine. In the middle of a headache, this is going to be so very sensitive. Now, we've talked about the vagus nerve. We did that with the ball. The vagus nerve is all over the body from the stomach to the heart and the outer part of the ear and behind the head. So this position, you feel your ear right here on the roller. And then now you're just going to turn your head. It's soft, which means it's slow. There really is not a lot of pressure that you're putting on, and it's comfortable. Again, this is going to be very sensitive if you have a headache. Learn how to do this, and it's whether it's 30 seconds or 5 minutes, it is up to you, but it's not over that time. It's not 2 hours. This is a very simple, easy treatment. The slower you go, the more those pressure sensitive nerve endings are listening, those sensors are listening and understanding, oh, I don't have to be so tense. And we're moving those fibers so they can slide and glide. And that's helping that hyaluronan that is very, it loves fluid. It just sucks it up like it's a diaper, a fluid in a diaper. But it also can get aggregated, which means clumpy. And if that hyaluronan in those deeper fiber layers gets clumpy, that's causing a problem. Anything that clumps up, we know, look at how the body works. We know that causes a problem. So we're going to move. And we're putting this behind the head. It's not on the neck. So notice I have all of my neck here exposed. This is on the back side of the hair. So where the hair is on the neck, on the scalp, on the scalp, on the scalp, this is where you want the roller. You can hold on to it. But in this position, whether your knees are bent or whether your knees are straight, this is up to you. Learn for yourself what's important and what's right. Okay. All right. So again, you can see that the roller is not on my neck. And all I'm doing now is I'm looking up a little and I'm tilting my head down. And I'm looking up and tilting down. Remember, we talked about the rectus capitis minor muscle. There's so many other muscles that you have here. You have semispinalis that is overlaying all those Rosetta Stone muscles. And you have the greater occipital nerve that has 3 different branches. And the greater occipital nerve going through the semispinalis, if the muscle itself has tension, that can compress a nerve. And that greater occipital nerve winds around to the trapezius muscle, to the muscle that's connected behind the ear, to the collarbone, the SCM. It's an amazing network. So we're doing this slow. We're tipping up and we're tipping down and we're tipping up and we're tipping down. So you have a greater occipital nerve You have a lesser occipital nerve, and then you have a third occipital nerve. And all those branches are everywhere feeding that scalp, feeding everything here. So you're feeling a tension headache and the scalp is sensitive. Take some time to focus on what you're doing. This is a treatment for you to help the body adapt. We want our tissues that are soft and pliable to stay soft and pliable, because then they'll do everything that they need to do. Now think about the brain tissue. We know when we sleep, the lymphatics, the brain tissue shrinks. So there's a lot more room for everything to flow and get out the icky stuff. And then fresh blood comes in. This is exactly what we want to do here. We want to rinse everything out. Take it slow so those pressure sensitive nerves, receptors, sensors can have a better conversation with their friends. Okay, so we are done. You did one side and you did the back of the head and the neck. Now, you have two sides of your head. So I don't have to tell you or show you the other side. It's something that you can do on your own. So use your tool that Grandpa and Grandma gave you. And if you don't have a tool that Grandpa and Grandma gave you, I'm going to put in the description in the show notes here, different places that you can go. Sue Hitzman has the melt method. Jill Miller has the yoga tune-up and the roll. If someone is watching this and they're from England, there's Anna with moving fascia. There's all sorts of things. Do something to help your body. Okay. Bye-bye.